Everyone, and welcome. My name is Chris Coyle. I am the Assistant Director for the NYESS Employment Policy Group, otherwise known as the New York Employment Service System, and this is Benefits 101. Today, we're going to talk about what we do, who we are here at NYESS. I'm going to touch on why employment is always a good idea for folks that we work with. I'm going to cover employment myths and facts. I'll talk about benefits advisement, why it's a good idea, where to find it. I'll talk about the new SNAP work requirements that took effect earlier this year in March. Then I'll get into the meat of the training, the SSA benefits and work incentives. I'll talk about two ways folks can save money without being penalized, ABLE accounts and PASS plans. I'll talk about the federal employment resource and Ticket to Work. And then I will share some statewide and national resources at the end. So first, who are we? The New York Employment Services System. We are a collaborator with all of the offices you see here. So the Department of Labor, we work directly with them and their team of disability resource coordinators to provide vocational services and benefits advisement around the state of New York. We work with the Office for the Aging, Office for People with Developmental Disabilities, Office of Addiction Services and Supports. We're overseen by the Office of Mental Health here in Albany. We work with the Department of Health, sharing their Medicaid resources, the Commission for the Blind, and New York State Education Department, specifically working with Access VR. So continuing with what NYESS is and what we do, again, we are a statewide partnership with those agencies I just mentioned. We do have a collaborative employment services case management system. In other words, we have a database that we ask OMH providers to enter their vocational services in, as well as there are some non-OMH providers across the state that are utilizing our database as well to capture the vocational services they are providing to their clients. Because of that database, we are a primary employment services data source. We are also a way to connect individuals, family members, providers to local Ticket to Work employment networks across the state. Our primary focus, as you see here, is being a resource for all things related to employment. Speaking of employment, employment is always a good idea. So what should we know? Employment is a key social determinant of health. That means that if folks are working and employed on some level, their financial health will improve. They may have more options because they're getting paid. Their physical health may improve. They're out in the community. They're active at their job. Their mental health will improve. And we know this through data that we have, that folks who are working and have a mental health diagnosis have a less intensive need for clinical interventions versus those folks who are not working. Socialization. Folks are improving their social network. They're interacting with others. They're engaging in a meaningful activity. Their self-worth improves, their work ethic improves. Overall, employment is a good idea because it improves one's quality of life. What about working while receiving public benefits? That is also a good idea. All of us, all of you listening, do not need to be benefits experts, but we do need to understand a couple of basics. Individuals will have more money in their pocket and will not be penalized for working while receiving SSA benefits as long as they are reporting their income monthly. Individuals will be eligible for Medicaid in almost all scenarios, and I'll talk about two significant ways, significant programs that are available to folks on SSI and SSDI that allow them to keep their Medicaid while they work. The common anxiety and frustrations associated with public benefits are real, and we need to include those frustrations, those anxieties as part of the conversation. We need to validate what folks are saying, right? Validate what folks are saying, but also give folks regional, local resources. Who can they talk to, right? And I'll share some of those resources in a minute. Many common myths about what happens when someone on public benefits earns wages are not real, and we need to address them in the employment conversations. So, speaking of myths, employment myths, here are a few of the myths that we hear most often, and I'm going to combat these myths with some employment facts in a minute. First one we hear a lot, it was hard to get my benefits. I'm going to lose them if I go to work. Second, I can only work a certain amount of hours. I cannot work because I have a disability. Or people insist I am stable before I can work. And finally, I'm going to automatically lose my health care benefits if I go to work. So let's take a look at these myths, but again, meet these myths with the facts. So the first myth again, it was hard to get my benefits. I am going to lose them if I go to work. The time it takes to get a decision on a disability application, so SSI, SSDI, some other public benefits, can vary depending on many things. The nature of a person's disability is certainly the main one, right? Also, how quickly SSA can get medical evidence from the person's doctor or other medical source. The total approval process is usually, I know this could be sooner or this could be longer duration, is usually 6 to 9 months, but can be expedited with more supported documentation of disability from additional sources, more medical sources, educational sources, that type of thing. There are work incentives available for people on public benefits that can allow them to continue to receive those benefits while they work. And that's what we're going to talk about in a few minutes. We're going to talk about what SSI is, what SSDI is, but also what are these safety nets, these work incentives that can really allow folks to go to work or go back to work and make that transition much easier by providing a safety net for folks. But let's look at the second myth. I must limit the hours per week I work in order to keep my benefits. So again, there are several variables involved in keeping SSA benefits while someone is working. It's not all about the number of hours a person works. Number of hours is a factor, but there are other variables. Certainly benefit type is a variable, SSI or SSDI. SSI is a needs-based program for folks with limited income, limited resources. They have different rules than the SSDI world. SSDI is Social Security Disability Insurance. It's an insurance program that we all pay into over the course of our working years, and the amount we get or we receive is based on what we earned over our working years, right? So there's different rules for SSI versus SSDI. Hourly wages is certainly a factor, and I'll talk about some of the rules around hourly wages in a few minutes. And of course, the work incentives. Those work incentives, again, those safety nets that allow folks to go back to work easier. A benefits advisor can provide clarity for everyone's specific situation. And that's key here, right? This is a general benefits 101, right? I'm offering you information today about various benefit types, about work incentives, but I'm also going to highlight the different resources, including benefits advisement, that is available around the state of New York for folks to engage in to get their specific questions answered. Great resource online called the SSI calculator. That is through the YTI online site. That's the Yang Tan Institute through Cornell University. Um, check that out. Check that out for yourself. Check it out for family members, friends, other beneficiaries. That really breaks down the effect of wages on an SSI check amount, right? There's also space in there to input information about work incentives. So it's a really useful tool for individuals to take advantage of to get an accurate idea of how work affects SSI and really how much better off they will be financially if they are working versus simply just receiving an SSI check each month. And I'll talk a little bit more about that as well. The next myth, I can't work because I have a disability. Well, SSA recognizes that individuals receiving benefits or individuals who have been determined disabled by SSA, SSA's definition, excuse me, can work, right? Folks with a disability can work. SSA established the SSDI and SSI work incentives designed to protect a person's cash and medical benefits while they work. So again, that safety net of work incentives, I'll get to those in a minute. But this is a direct fact that combats this myth of the idea that folks who have a disability can't work, right? People insist that I am stable before I can work. The myth that individuals must be considered ready or stable or even compliant before they go to work is simply not true. Work is a key recovery tool for individuals with mental health issues. And you're going to hear me say that a couple more times today. The evidence-based practice of IPS, individual placement and support. Evidence-based practice focuses on this idea via one of their key principles called the zero exclusion principle. Okay. Zero exclusion means that anyone, whether they are exhibiting mental health symptoms or dealing with any other type of barrier, if that individual expresses interest in working, that individual should be given an opportunity to work along with ongoing supports, right? Along with every other resource they need, right? So via ongoing supports, they have an opportunity, they can meet with their employment specialist, start to talk about work, get an idea of what they want to do. That's the idea behind zero exclusion, right? We're not going to say to someone, you can't work because you are not stable yet in your symptom management, or you are not stable yet in your adherence to our program rules, right? We are going to continue to support you in dealing with those challenges, but we're also going to infuse a conversation about employment in that menu of recovery items, if you will, right? So along with those ongoing supports to address the barriers, we're going to honor your requests and engage in an employment conversation. We're not going to exclude that idea based on the barriers we see, right? We're going to help you address those barriers and include you and give an opportunity to you to explore employment of your choice. And again, as I just alluded to, supports are available to help a person obtain or maintain employment even while they are managing barriers to employment. So mental health symptoms could be housing or transportation needs, could be educational needs, etc. Final myth here that's on our slide for today, I will automatically lose my healthcare benefits. This is one that we hear most often, and it's one that is certainly an understandable concern for folks. If they work and they replace their SSI with work earnings, that's a good thing, right? But if they work and don't receive Medicaid anymore or can't receive Medicare anymore because of wages, that may disrupt life on a much grander scale, right? So there are ways for a person to maintain both their Medicaid and or Medicare benefits if they go to work and earn more than allowable by benefit. Few ways here, right? Medicaid 1619B. I'll talk about what these mean in a minute. Medicaid buy-in for working people with disabilities. Those two programs allow folks to keep their Medicaid coverage and make a substantial amount of money, increasing their quality of life while keeping that safety net of health insurance available. And for folks on Medicare, there's an option of continuing Medicare benefits. Again, I'll talk about those in a second. So let's look at, before we dive into benefit types and work incentives, let's look at benefits advisement and why benefits advisement is so important for individuals on any type of public benefit. So benefits advisement resources and information must be within everyone's reach. Anyone who receives public benefits of any kind should be connected to benefits advisement. Each situation and benefit financial picture is different and needs to be considered. Everyone's situation is their own. There's a lot of different variables that individuals are facing that affect their benefits, right? Living arrangement, amount of money they're making, type of disability, any type of support, financial support they're receiving. Those are all individual variables that need to be considered. So that's why benefits advisement is so important. Do you have a go-to benefits advisor for individuals? If your answer is no or you're not sure, contact us here at NYESS, the New York Employment Service System, to let us help you find one near you. Here is a link, career services for persons with disabilities through one of our partners, Department of Labor. They have a team of benefits advisors across the state, including New York City. In New York City, those disability resource coordinators, as they are called upstate, in New York City, they are called program managers. And those folks across the state are certified benefits advisors. And they can help you really walk you through your options and validate your situation and give you next step advice so you can make the best informed decision possible for your situation. Those again are disability resource coordinators through the Department of Labor. Their site is the Career Services for Persons with Disabilities. Do you have a go-to site for information about benefits? If your answer again is no or you're not sure, contact us. We can help you figure it out. Our homepage is on the bottom here. It's nice.ny.gov, so NYESS.ny.gov. On there, we have resources for providers. We have resources for individuals or customers. We also have a learning center on our homepage. So please feel free to peruse our site. Again, nice, NYESS.ny.gov. Right on our homepage, we have a tab that you can hit to find a local benefits advisor near you. So great resources there. Please utilize them when you can. Continuing with benefits basics. Again, we don't need to know all the details, but we should know some basics, right? SSI and SSDI are separate SSA benefit types, as I mentioned a minute ago, and calculate wages in different ways. But in either case, working is always a good idea. You see it there. Always consult a benefits advisor, right? That's another theme in today's session. Individual circumstances are always present. Always consult a benefits advisor. Wages must be reported in all scenarios to reduce the possibility of overpayments or related penalties. But if they do occur, again, consult a benefits advisor to help with navigating that process. If an individual earns enough for cash benefits to stop, there are still ways to continue to receive Medicaid, as I mentioned a minute ago. For folks on SSI, 1619B of the Social Security Act. And for folks on SSI or SSDI, the Medicaid buy-in program for working people with disabilities is another option, and I will dive a little deeper into those two options in a few minutes. If individuals would like to save money, save more than the allowable resource limits, there are two ways to do so: through Achieving a Better Life Experience Act, or an ABLE plan, or through a PASS plan, a plan to achieve self-support. So again, I will touch on those two ways in a couple minutes because we know that a lot of folks on SSI are concerned about the resource limit. Can't have more than $2,000 in cash resources in your checking account or savings account. So that certainly inhibits folks' ability to save money. But there are those two ways on the bottom that I will talk more about in a few minutes. Okay, let's talk about healthcare. Healthcare, in our experience, has been the number one focus, the number one concern of individuals who are going back to work. Can I keep my Medicaid? Can I keep my Medicare? So these are three major ways folks can keep their medical benefits. Again, You've heard me mention this a couple times. The Medicaid 1619B. 1619B is a special Medicaid rule that allows an individual to maintain Medicaid coverage even if their earnings become too high for an SSI cash benefit. Eligibility requirements for 1619B. The individual was eligible for SSI cash benefits for at least a month. They will be eligible for an SSI cash benefit except for the earnings. They are still disabled. They still meet all the other eligibility rules, including the resources test. So they still can't have more than $2,000 in resources, but I'll talk about a way in a second that folks can utilize 1619B and enable account. They need Medicaid to work. They have gross earned income that is insufficient to replace SSI or Medicaid. So let's look at the nitty gritty here. Let's look at the numbers. So 1619B continued. If an individual is eligible for 1619B, it should be an automatic process. And by that I mean if the individual is working and reporting their income monthly to the local SSA office, it should be an automatic process for them to continue to receive their Medicaid coverage. Okay. However, folks can still alert SSA by using this template letter that is accessible via our site. That's nyess.ny.gov/template letter. Look at the rules here. Look at how much money folks can make and keep their Medicaid. Second bullet here. Gross income can be as high as $68,654 for SSI beneficiaries in 2026. I am recording this in early 2026. That number will change annually. So we'll make sure to update this each year. But as of this year, 2026, folks can keep their Medicaid and make up to $68,654 if they are not receiving SSI due to work earnings. Third bullet here, as I mentioned, resources still need to remain under the $2,000 limit per the SSI rules, but individuals can take advantage of other ways to save money, penalty free, that achieving a better life experience account, an ABLE account, and or a plan to achieve self-support, a PASS plan, can also be used in conjunction with 1619B. What about folks who are not only on SSI? What about folks who are on SSI and or SSDI? Or if they're not on either one of those but have a qualifying disability for those benefits, how can those folks work and keep their Medicaid? Well, here it is. Medicaid buy-in for working people with disabilities, otherwise known as MBI WPD. The Medicaid buy-in program offers Medicaid coverage to individuals with disabilities who are working and earning more than the allowable limits for regular Medicaid. It is free Medicaid in the state of New York in 2026. I know that the title says Medicaid buy-in. That is a federal title. Some states do charge a premium, modest premium for this program. At the time of this recording in early 2026, New York State is not charging a premium, so it is free Medicaid. The second bullet, similar to 1619B, there are very high income thresholds. Gross income can be as high as $79,885 for an individual and $108,285 for a couple. So that's a salary. Gross income salary can be as high as $79,885 for an individual, $108,285 for a couple. That is a really decent wage, and you can still keep your Medicaid. This is a big deal. 1619B and the Medicaid buy-in program are huge programs available to folks on public benefits who are concerned about the effect of earnings on their medical insurance. Okay. Two ways folks can keep their Medicaid and go to work. Third bullet here, non-exempt resources. that do not exceed the MBI WPD resource level of $33,038 for one person household and $44,796 for two-person household. In other words, that means that an individual who is continuing to receive Medicaid through the Medicaid buy-in program can make over $79,000 a year and have over $33,000 in resources. Again, a resource is cash, checking account money, savings account money. Any investment property would be a resource. Retirement account would be a resource. Um, an extra car, maybe it's a car they don't drive, but it's in their driveway. That would be considered a resource because they can sell that car for money. But the levels are quite high here, and this allows again for many more options for the individual to enjoy their life. A much higher quality of life is achieved if folks know that they can work, make a decent amount of money, keep their Medicaid, and oh, by the way, save a substantial amount of money as well. Medicaid buy-in for working people with disabilities. To learn more about the Medicaid buy-in program, another one of our partners, the Department of Health, has a toolkit, the Medicaid buy-in toolkit. That's the link there. If you don't want to copy that entire link down, you can simply Google New York State MBI Toolkit, and it should take you to that site. The process to continue Medicaid through Medicaid buy-in is slightly different for this program versus 1619B. If you recall, 1619B Medicaid coverage should be automatic if the individual on SSI is reporting their income. With Medicaid buy-in, there is an application. So you can get that application on the Department of Health's site here, along with many answers to frequently asked questions. What about Medicare? So most individuals who receive SSDI, so Social Security Disability Insurance, are also eligible for Medicare coverage. Following what's called the trial work period, and I will touch on the trial work period in a minute, or TWP, individuals can continue to receive at least 93 months, which is 7 years and 9 months, of Medicare coverage, including hospital insurance, Part A, premium free, supplemental medical, Part B if enrolled, prescription drug coverage, Part D again if enrolled. That is a huge benefit. Folks can keep their Medicare and have their hospital insurance, supplemental medical, and prescription drug coverage for 7 years, 9 months. After premium-free Medicare coverage ends due to work, the individual can buy continued Medicare coverage as long as they remain disabled. Okay, moving from Medicare coverage to new work requirements. Again, I am recording this in the first quarter of 2026. As of March 1st of 2026, there are new work requirements for folks on the Supplemental Nutrition Assistance Program, otherwise known as SNAP. So I'm going to touch on those SNAP work requirements here. So as I just said, these work requirements took effect on March 1st of 2026, and this is for all able-bodied adults without dependents, or ABODs for short. An ABOD is an individual between the ages of 18 and 64 who is able to work and not living with a child under 14 years old. ABODs are now required to work, volunteer, or participate in job search or training to get SNAP benefits for more than 3 months. Work requirements include 20 hours per week of paid or unpaid work, or working at least 20 hours per week, or earning at least $217.50 per week, or performing in-kind work by exchanging services for something other than money for at least 80 hours per month. There are some exemptions to the SNAP work requirements. Individuals might not have to follow every single rule here if they fall into one of these categories. or more than one. The individual is younger than 18 or older than 65 years old. Someone in the household is younger than 14 years old. The individual receives disability benefits, such as Veterans Affairs benefits or New York State disability benefits, SSI or SSDI. For a full list of the work requirement rules and their exemptions, please visit another one of our partners, the Office of Temporary Disability and Assistance, OTDA. That is their site there. That's www.otda.ny.gov/programs/SNAP. So moving from SNAP and work requirements to benefits and work incentives. Next few slides, I'm going to describe some basic information about each benefit type, SSI and SSDI in this case, and some of the specific work incentives associated with those benefit types that, again, make going back to work or going to work easier for folks on those benefits. Again, please reach out to a benefits advisor to get answers to your specific questions about your situation. So let's talk about SSI, Supplemental Security Income. As I mentioned earlier, SSI is a needs-based program. That means that the SSI program provides a cash benefit payment to people who need it. They have limited income and limited resources. Specific rates for SSI listed below here have the potential to change at the start of each new year. Again, at the time of this recording in early 2026, the federal benefit rate is $994 a month. These are all monthly rates. In New York State, there's an $87 supplement. So the $994 plus the $87 New York State supplement gives folks a $1,081 amount each month if they are living on and receiving SSI only. Okay. This amount will change though, given living arrangements. So if an SSI recipient is receiving some sort of financial support, they call it in-kind support, that number will be less. The resource limits for 2026, again, the resources, checking account, money in a savings account, right, that I mentioned a minute ago. For a single individual, they can't have more than $2,000, or an individual with a spouse, $3,000. So you can see here, just living off of SSI, so $1,081 in the state of New York, plus being confined to the resource limit of $2,000 in savings, really does inhibit folks' ability to save money, to have options in life, right? But there are work incentives out there, which I will again talk about in a minute. Here's a few. There are more than these, but these are the few that we're going to talk about today. I will make sure that you all have that SSA link that includes all of the work incentives at the end of the training when I review the resources. Okay, so the SSI work incentives I'll talk about today: student earned income exclusion, impairment related work expense, and blind work expense. So first, what is the student earned income exclusion? This allows a person who is under the age of 22 and is regularly attending school, either part-time or full-time, and they're working either part-time or full-time, to exclude some of their earnings from their countable income when SSA calculates their SSI benefit. In 2026, the amount that can be excluded from their countable income is $2,410 per month, up to an annual maximum of $9,730 a year. Here's an example. A 19-year-old who's attending school part-time and working part-time earns $1,500 in a month. That 19-year-old is going to contact SSA and let them know that he is going to use the student earned income exclusion for that month. He will be required to submit his wages, which again, he should already be doing on a monthly basis to SSA, and send confirmation that he is attending school. So he can go to his local registrar's office or any school office that has any type of proof that he can then obtain and send into SSA that says, hey, he's a 19-year-old going to school. He can use this benefit each month up to the annual maximum. That annual maximum, again, is $9,730. If he earns more than $2,410 in a month, the maximum that can be excluded for that month is the $2,410. Why is this a good thing? This is a good thing because it gives folks who are a student under the age of 22, gives them a safety net and allows them the ability to go to work while still receiving some of their SSI check or even all of their SSI check. You see the example here. The 19-year-old is earning $1,500 that month. He's going to keep that $1,500 that he earns. He's also going to be able to exclude all of that money, the $1,500, because it's less than the $2,410. So SSA is not going to count any of that money that he made, any of that $1,500. So the 19-year-old is going to keep the money, the $1,500. SSA is not going to count any of that. He's going to get a full SSI check plus the money he made. So it really gives folks an opportunity to test their ability to work, to really open their possibilities outside of just receiving SSI in terms of how much money they can make and earn, right? It ignites them, activates folks to the working world. That's a good thing. Next work incentive for folks on SSI, something called the impairment related work expense, or IRWE. So IRWEs are costs for items or services that an individual needs to work because of their disability, and these costs are not reimbursed by others. Social Security will deduct the costs of an IRWE from their countable income when determining their eligibility for Social Security disability benefits. There is what's called an IRWE approval request form. There is the link there. Let me get to some examples of an IRWE. There are many examples of IRWEs. These are a few. So supported employment services could be an IRWE. For example, if I need a job coach and I need a job coach because of using SSA words, my impairment, it's related to my impairment, right? And I need the job coach to be successful at work, and it's an expense to me. So I'm paying the job coach. Maybe I'm paying the job coach $20 an hour and I need him for a couple hours a week, right? So let's say 2 hours a week times $20 an hour, that's $40 in a week. We'll say roughly $160 a month. That $160 in IRWE expenses is going to be used to deduct, it's going to be deducted, I should say, from my countable income that SSA looks at. All right, so if I'm making $900, it's going to be $900 minus the $160. It's going to give me that amount. And that's the amount that SSA is going to look at when determining my SSI check amount. Attendant care could be an IRWE. Transportation costs could be an IRWE. Medical devices, prosthesis, any work-related equipment or assistance, medications could be an IRWE, right? If I'm paying for medication because of an impairment, I need the medication to be successful at work, that could be an IRWE. Therapies could be an IRWE. Let's look at, I mentioned there was a transportation could be an IRWE. There is a what they call a decision chart for transportation if it's under consideration as an IRWE. So starting from left to right, if public transportation is available in the community and it can be used by the individual with a disability, then the expense cannot be used as an IRWE. So if I can use a bus, I can take a bus and I have a disability, I can't use the bus fare as an IRWE, right? However, if public transportation is available in the community and the individual cannot use it, then the cost of a cab or taxi or specialized service or own vehicle could be an IRWE depending on the necessity and verification of payment of that expense. If public transportation is not available in the community and the individual can drive an unmodified vehicle, then these expenses cannot be used as an IRWE. So if I have a disability and I'm driving myself to work, I can't use the gas expense or the wear and tear on my car as an IRWE. However, if public transportation is not available in the community and the individual cannot drive an unmodified vehicle, the cost of operating a modified vehicle, including mileage to or from work, or purchase and repair of the modifications to a vehicle could be deducted. So specific rules around transportation as an IRWE there, okay? Next work incentive for folks at SSI is the blind work expense, or BWE. So similar to an IRWE, the BWE is a cost for items or services that an individual needs to work, and these costs are not reimbursed by anyone else. However, the blind work expense does not have to be related to an individual's specific disability. So there's a little more freedom here in how folks can use a BWE versus an IRWE. They do have to, the costs of a blind work expense do have to be reasonable according to the SSA definition. So reasonable is a cost that is usually charged for the covered or similar service or supply. So let's look at some examples of BWEs, and this might look familiar because yes, it is the same list I had for IRWEs. Again, there could be many different kinds of blind work expenses. But this is the list that we had just to show you that there are a lot of similarities between IRWEs and blind work expenses. So again, supported employment services could be a BWE. Attendant care, transportation costs, medical devices, prosthesis, work-related equipment and assistance, medications, therapies, right? These could all be blind work expenses. If I need it to go to work and I'm paying for it, even if it's not associated with my disability, right? I can still use these as a blind work expense. So that was SSI, needs-based program, and a few of the work incentives available to folks on SSI. Switching gears here, different world here. Social Security Disability Insurance, SSDI. SSA provides cash benefits to individuals who have worked and paid into the SSA insurance program through our taxes, right? If you're working right now, you're paying into the SSDI, the SSA, I should say, insurance program to then, if you ever need it, receive SSDI, right? So we're paying into the system via our taxes. And the amount individuals receive is based on earnings and duration of employment. So how much did you make? How long did you work? There are several work incentives available for individuals who receive SSDI and want to go to work. Here are a few. Trial work period, or TWP, extended period of eligibility, or EPE, and expedited reinstatement, or EXR. So first, the trial work period. A lot of folks have heard about this. The trial work period allows an individual to test their ability to work for at least 9 months without losing their SSDI benefits. They will receive full SSDI cash benefits regardless of how high their earnings might be if they report their work activity and they continue to have a disabling impairment. There is a number associated with the trial work period. The individual's trial work period begins when they earn over $1,210 per month, also known as the trial work level, or TWL. In 2026, this level may change at the start of each new year. So let's look at an example of a trial work period. If an individual is currently receiving SSDI benefits and they want to go to work, they have a 9-month period to earn as much money as they want or can as a safety net to see how working goes. If an individual earns $1,210 in January, let's say, SSA will count January as the first trial work period month. If the individual's income falls below the $1,210 the next month in February, that month will not be counted as one of the 9 trial work months. The trial work months do not have to be consecutive. In fact, they are a rolling 9-month period over a 5-year period, over a 60-month period, right? Folks can work this month, not work for a year, then work again and make over $1,210, and that would be their second trial work period month. Doesn't have to be consecutive, right? Just has to be 9 months over a rolling 5-year period. Next SSDI work incentive, extended period of eligibility, or EPE. So what happens when the trial work period ends? I've used up my 9 months. I want to keep working. What happens here? Well, that's when the EPE kicks in. It automatically begins the month after the trial work period ends. What is the EPE? It is a 36-month period in which an individual will receive SSA cash benefits for all months their earnings are below the SGA level. SGA is substantial gainful activity. In other words, SGA means working and earning a certain amount of money. So this year, in 2026, the monthly SGA amount is $1,690. So again, the EPE, 36-month period in which an individual receives SSA cash benefits for any month their earnings are below the $1,690 level, the SGA level, if they continue to have a disabling impairment. It's another safety net for folks. Here's the example. Once the trial work period ends and an individual earns over SGA level the first time, so now we're earning over the 1690, the first time, the process starts to suspend benefits. The process includes a 3-month grace period of a cessation month and 2 additional grace period months. During those 3 months, the individual still receives SSDI, okay? But they're only paid again when earnings are below the SGA amount for the remainder of the 36-month extended period of eligibility. This is a safety net. This is another phenomenal work incentive for folks to be able to continue to work or test their ability to work. And if they know that if they lose their job or if their hours get cut or whatever happens and they're making less than $1,690, they can start to receive SSDI again. It's a safety net. Okay. Great work incentive there. Continuing with the SSDI work incentives, expedited reinstatement. I should note that expedited reinstatement, or EXR, I have it under the SSDI slides here. It's also available for folks on SSI as well. So what is it? It's a safety net for people who successfully return to work and their SSDI or SSI cash benefits are suspended. If an individual's cash benefit payments end because of their increased earnings, and within 5 years, their earnings fall below that SGA level, that substantial gainful activity level of $1,690 a month, they may be able to have their benefits started again right away through a request for EXR. So in other words, via EXR, folks can begin to receive benefits again. Usually right away is usually within 30 days. But that's a very good thing. It's a safety net versus having to reapply and wait the 6 to 9 months or longer, right? So this is another work incentive to include in the conversation you have with anyone on a public benefit, right? In this case, SSI or SSDI. If folks are concerned about going to work And I don't even say losing benefits, I say replacing benefits, right? We want to get in the habit of saying, I want to replace my SSI. I want to replace my SSDI with my work earnings, right? Or if we're speaking with someone, you have the opportunity to replace your public benefits with work earnings, right? Um, but again, the point here is that if an individual is concerned about the effect their work earnings will have on their benefits, you can tell them there is a work incentive out there, along with all the other ones I talked about today, that allows you to receive your public benefits quicker than having to reapply. And that work incentive is expedited reinstatement. Okay, so we talked about benefits advisement. We talked about where to find benefits advisement. We talked about healthcare. We talked about the new SNAP work requirements. We talked about SSI and SSDI. Let's cover a couple significant ways and really easy to use ways folks can save money and have that higher quality of life, right? And that's ABLE accounts and PASS plans. So ABLE accounts, another acronym I know. It stands for Achieving a Better Life Experience, ABLE. So an ABLE account is a savings program for eligible people with disabilities who have resources that would make them ineligible for other benefits. Here's an example. If an individual receives a $10,000 inheritance from someone in their family, right? And they put that money in a regular savings account, they will be over the resource limit for SSI and will automatically lose their SSI benefits. However, if they put the inheritance in an ABLE account, that $10,000 inheritance in the ABLE account, it will not count toward their resource limits and they can maintain their SSI benefits. More information on ABLE here. What are the rules? What's the eligibility? A disability must be present prior to age 46. Again, recording this in early 2026. This was recently increased from age 26 on the first of this year. So this has really opened up eligibility for millions of more people. So last year in 2025, you had to have a disability that was present prior to age 26. Now it's age 46, which again opens up a lot more options for a lot more people, right? Look at the second bullet here. Balances under $100,000 are excluded from the SSI resource limit. So as you know, as we touched on, the SSA rules for folks on SSI, you can't have more than $2,000 in resources. However, folks on SSI can use this ABLE account, and balances under $100,000 are not going to be held against them as a resource. It's not going to affect their SSI. How can you use the money in an ABLE account? You can use an ABLE account money to pay for many things. They're called qualified disability expenses. So you can use it to pay for medical and living expenses, to maintain your health, your independence, and again, maintain your overall quality of life. I do have a resource at the end here that I'm going to share on how you can get in contact with statewide ABLE folks who can really help you out, and federal ABLE resources as well. Another way folks can save money, PASS plans is a plan, to achieve self-support, a PASS plan. This, however, is for folks just on SSI. So they're receiving SSI and they might have some money to put aside. What are their options? Well, a PASS plan allows a person to set aside money other than their SSI check for a specific period of time. Could be a couple months, could be a couple years, so that they can go to work and achieve a work goal or work goals without losing their SSI cash benefits. So here's an example. If the individual on SSI needs a car to get to work, they can set up a PASS plan to save money toward buying that car, and the money that's in their PASS plan for the car will not count against them as a resource. Because if you think about it, in 2026 and beyond, if you can only have $2,000, you're not going to get a great car, right? You might get a car that's a little past its prime, let's say. So if an individual wants to save money, maybe they want to save, they have a plan to save $10,000 to get a semi-decent car, right? Used car, new car if they have some sort of luck, right? That $10,000 is not going to be used against them, okay? Because they need the car to go to work and they're putting it in a pass plan. They can still receive their SSI. Important note here on pass plans. A little different than ABLE accounts. So ABLE accounts, folks have a lot of freedom in how they spend their money. Again, they're called qualified disability expenses. Pass plans, there are a few more rules in how folks can spend the money that's in a pass plan. The money that's in a pass plan can only be spent on their identified work goal. So in this case, let's say it's $10,000. You can only spend every dollar of that $10,000 on that car, on buying that car. If you take out $100 and you pay your utility bill, or $500 as it were to pay your utility bill, that's going to be counted against you. And you might be facing an SSI overpayment because you're still receiving an SSI check even though you have $10,000 in your pass plan. So the important note here, pass plan is for folks on SSI who have a work goal, who want to save more money than $2,000. And the rule is you have to spend the money on your identified work goal. You can't spend it on anything else. Can't go out to dinner, can't pay your other bills with it, can only be used towards your identified work goal. And I do have a resource for pass plans coming up in our resource section. Okay, Ticket to Work. Ticket to Work is a federal program. It's a federal employment program through SSA that can work in coordination with a person's existing supports. Eligibility for Ticket to Work is for folks on SSI and or SSDI benefits. And those individuals are between the ages of 18 and 64. And they want to go to work and are expected to make some sort of progress. They call it timely progress. If a person assigns their ticket is in quotes because it's not a paper ticket anymore, it's electronic. If a person assigns their ticket to an employment provider, SSA will suspend what's called the Continuing Disability Review, or CDR, if they are making timely progress. And that's a good thing. CDR is the process by which an individual needs to sit in front of a board or a few people to prove that they still meet the definition of disability in order to still receive disability benefits, right? Not a very pleasant experience. So if someone is in the Ticket to Work program and they're making progress, they don't have to go through that CDR. The employment provider can assist the person to prepare for, obtain, and maintain employment. The employment provider can also offer benefits advisement so the person can better understand how working will impact their benefits. So we've covered a lot today. What can we do? What can we continue to do, right? We always want to increase the belief that work is possible and positive for one's recovery, whether it's mental health recovery, substance use recovery, anyone with a disability, anyone with a diagnosis, right? Increase the belief that work is possible for everybody. What does that look like? Well, we can post motivational posters. We can post employment information on our bulletin boards. We can host diversity fairs. We can even post information about trainings like this. We send out information on our listserv every quarter on trainings, right? Post that information. We should be discussing employment at intake meetings. We don't want folks to just sit at our program for years and years. We want folks to move through our program, right? And we should be including employment in that conversation, certainly along with every other support they need to address their barriers, right? Their challenges. We should include and discuss employment at team meetings. We should celebrate employment successes. We love to celebrate success stories. We love to share success stories of people who have moved from total reliance on benefits to working on some level or working and completely off of benefits, right? So if you have success stories, please send them to us, right? You can reach us at nice@omh.ny.gov. You'll also have my email at the end of this. You can email me. We also want to support employment conversations with employment specialists and the team. That's important, right? The employment conversation should not just be for the vocational team. Everybody should be talking about employment. That includes psychiatrists, social workers, every other clinician, family members, friends, peers, right? We should all be talking about employment. And also, we want to increase awareness of local employment opportunities, right? Where can people go? Who's hiring? How can we find out about those employment opportunities, right? Okay, resource time. So, SSA myths and facts. That is a link from our site. We are connected to the Employment First site. So for more information about SSA myths and facts, you can go to employmentfirst.com/nice/get-the-facts.pdf. For more information about those ABLE accounts, Achieving a Better Life Experience accounts, you can go to that site. You can also go to a state site, New York State site. It's called mynyable.org. So that's mynyable.org. And that is the statewide ABLE entity. They are through the state comptroller's office. They are phenomenal folks over there, a great resource. I have used them myself. For more information, there's a 1-800 number. You call the number and a real life human person answers it. So that's nice. So please reach out to them or reach out to myself or our team for more information about ABLE. Past plans, again, another way folks can save money without penalty, the plan to achieve self-support. You can find more information about past plans on the Federal Ticket to Work site or on the passonline.org site. That is a great resource through Cornell University. I should have put the link here, but it is Pass Online. It's www. all one word here, passonline.org. So www.passonline.org, passonline.org. Additional resources, we created at NICE a job seekers guide for employment. That is just a very comprehensive guide for folks looking for work. What do they need to do? What do they need to think about? What do providers need to think about? Where are the resources around the state that everyone can utilize? That's through our site here, our connected site through Employment First. SSA Red Book, that is the federal official Red Book from Social Security Administration. That has every rule, every official rule about work incentives and benefit type in there. Will I lose my Medicaid if I work? Again, we're talking about Medicaid 1619B and Medicaid buy-in, those two programs that allow folks to make a considerable amount of money and keep their Medicaid. There is more information at the Federal Ticket to Work site. That is that choosework.ssa.gov site. Also including here the new SNAP work requirements through our partners at OTDA. That is www.otda.ny.gov/programs/SNAP. Questions, concerns, if you want to share a success story with me, please reach out. I am Chris, the Assistant Director here at the New York Employment Service System Employment Policy Unit at the Office of Mental Health. That is my email, christopher.coyle@omh.ny.gov, and my phone number, 518-473-7514. Thank you all for joining today. I really appreciate everything you're doing, and take care.